Hello and welcome to this video about the kidney stone journey. As you know, having a kidney stone can be very painful. So this video is designed to talk about the initial treatments that people can have for their kidney stone pain, what you can expect at the urology clinic appointment, and finally, for those who need to have surgery on their kidney stones, some information about kidney stone procedures. Renal colic is a painful condition caused by kidney stones blocking the flow of urine from the kidneys to the bladder. Blockage of the kidney causes it to swell, and this is actually what leads to pain. The pain can be felt starting from the back and can move into the lower belly, groin, and genital areas. There's nausea and vomiting, and people often feel a urgency to urinate. Blood in the urine is very common. Now we're going to talk about the initial treatment of renal colic. If you've been to the emergency room due to renal colic, you may have had experience with some of these already. So the first class of treatments are the narcotic painkillers. As you know, narcotics can be very powerful, but there is the potential for side effects: sleepiness, nausea, vomiting, constipation, decreased breathing, and there is a possibility of dependence as well. So this is something that we try to only use for emergency situations. Another class of medicines that can work quite well are called NSAIDs. You may have been given ketorolac, or you may be taking Advil. This medicine minimizes swelling to reduce the pain caused by renal colic. It doesn't dissolve or take the kidney stone away, but can be quite effective in managing it and avoids all the side effects of narcotics. Flomax is another medicine that is often prescribed. It is in a class of medicines called alpha blockers. They work by relaxing the muscles in your ureter, which can allow the stone to pass more easily. Another piece of advice that may be a bit different than what you've been told is when it comes to drinking fluids, it is important to stay hydrated, but sip rather than drink large amounts quickly. Drinking a large amount quickly can cause a lot of urine to be made at once, and that can cause pressure on the kidney. For a lot of patients, this seems to make a big difference. Now, once the pain has been managed, it may take several weeks for the stones to pass naturally. This is definitely a challenging time, physically and emotionally, but it may be a good approach that can avoid more invasive procedures like surgery. However, if at any point while you're waiting, new symptoms arise such as fever or inability to eat and drink, it may be necessary to come back to the emergency room. These symptoms could signify complications related to kidney stones that may require emergency treatment. So if you have fever, you can't eat and drink, and the pain is not controlled, you should go back to the emergency room right away. Next, we'll talk about the urology clinic appointment. When you come to the urology clinic appointment, one of the first things that we'll talk about is arranging imaging to confirm whether the stone has passed. This may include an ultrasound or CT scan, both of which can tell us if the stone has passed or not, and if not, the location and the size of the stone. If it turns out that the stone has not passed, you'll generally be given up to 6 weeks for this to happen naturally before a procedure is recommended. In some cases, however, surgery may be necessary if we feel that the stone is too large or if you're simply not able to cope. If your stone has already passed by the time you come to the appointment, if you bring the pieces, we can get it analyzed. We may still arrange an ultrasound to confirm that everything is passed and that there are no consequences to the kidney from the blockage. We'll talk about instructions on dietary changes and lifestyle modifications. As a part of this process, we may also talk about arranging a 24-hour urine collection test. This allows us to find if there's an underlying reason behind why you developed kidney stones in the first place. In the future, this information can help us recommend other treatments and to prevent stones from coming back. If your doctor is recommending surgery for the stone, then the most likely procedure we'll be talking about is called ureteroscopy and laser lithotripsy. This involves using a special instrument called an endoscope to look inside the urinary tract and to locate the stone. This is all done under general anesthesia and sometimes spinal anesthesia as well. Once the stone has been located, a laser is used to break it up into small pieces, which can then be easily removed. The procedure is safe in general, however, your doctor will let you know specific risks related to you. The biggest complaint after ureteroscopy is symptoms related to what is called a ureteric stent. This is an excellent pamphlet that I'm referring to with the reference listed above. So a ureteral stent is a flexible plastic hollow tube that helps the kidney drain after kidney stone surgery. It's very important to place a stent in almost all cases because there's going to be swelling and irritation from the procedure. The stents prevent small stone fragments from blocking the ureter and causing really severe renal colic. It can also prevent little blood clots and spasms of the ureter from causing pain. So it is very helpful in many cases, but it can cause some symptoms. For example, having to urinate very frequently and urgently, or having a burning sensation or pain in your lower back. This is all very common. A lot of bladder symptoms like feeling that you can't empty your bladder completely, seeing blood in the urine. And the purpose of educating patients up front is that so they're not so taken back by these symptoms, and just to know that these symptoms are all temporary, and by the time the stent is removed, all the symptoms are generally going to improve. So how does one manage the stent symptoms? Drinking plenty of fluids, taking medications, pain medications as needed, other medicines that can help to relax the ureter, or using a heating pad and taking a warm bath can all help. How will this affect your daily activities living with a stent? You may restart your normal physical routine, but if you see more blood in the urine as you get more active, then it's time to rest and drink fluids. Having a stent should not affect your work activities or social life or travel, but you do have to make certain accommodations. For example, you'll have to use the bathroom more, so you have to plan for this. Having a stent should also not affect your sex life. However, if you do have a stent with a string coming outside of the urethra, sexual activities may be difficult. But all these symptoms generally go away once the stent is removed. How do we remove the stent? It is generally removed within a few days to a few weeks after surgery. It really depends on how long your doctor is recommended to stay in for. If there's a string on the stent, it could be removed easily. And if there's no string, it will require a cystoscopy procedure to take it out. And that is done under local anesthesia. You don't have to be put to sleep for it. Once the stent is officially out, you're almost out of the woods, but you still may have some discomfort, which should pass with time and get better over the course of several days. But if you develop fever or have other concerns, make sure you tell your doctor. So when should you call your doctor through this whole journey with having a stent? Well, having fever or chills, nausea or vomiting, and unable to drink or keep down fluids, severe pain that is not relieved by the pain medication that you've been given, being unable to urinate, or constantly leaking urine, or very rarely finding that the stent has fallen out. These are reasons to call. But just remember, the stent can be uncomfortable. It can cause a lot of urinary symptoms, some minor pains and discomforts that you are able to manage otherwise on your own, and blood in the urine. These symptoms are all going to be present until the stent is removed. So these are not reasons to worry. I hope you found this information useful. It is a really overwhelming and complicated journey if you've never been through it. So hopefully this information will guide you as you get your kidney stone taken care of. Thank you very much.